to make this presentation. We try to do a lot of these. Like to do this because it allows us to share the resources and services that 211 has to offer. And some of you may have heard about 211, may have just heard the number, but don't know exactly what it is. But 211 is basically a nonprofit. We provide San Diegans with public information. We refer them to social and healthcare services and program enrollment and more. And we offer round the clock availability by phone or by email. And let me say, I forgot to say, I know I'm going to try to do like 15, 20 minutes. I know we have time for a Q&A later. However, if I say something that you're unclear about, or if I'm speaking too fast, feel free to interrupt me. So as I said, 211 is a nonprofit, and it was officially launched in 2005. And how it came to be is that in 2000, the Federal Communications Commission, reacting to reports and studies, assigned a three-digit number, 211, that could be used across the nation. And the reason they did this is a couple of reasons. After the 9/11 attacks, they found there was a lot of reports that looked into what happened. And one of the things that repercussion that came out of that was that it was determined that 911 was being overloaded with phone calls. And some of the phone calls weren't truly emergencies. Some of the phone calls were really about, hey, where can people go to evacuate? Where can people find shelter? Where can people get food? But the other thing that was determined was that there were a lot of different numbers and resources. There was a number for the food bank. There was a number for the shelter. But it made it difficult for people to reach those services because they add all these numbers and people are trying to remember. So what they decided was, let's come up with three numbers that people can remember and call, and therefore make it easier for them to get service. So in 2000, 211 was designated by the federal government as that information referral number. And then here in San Diego, we locally actually launched 211 in 2005. Since the 2000 designation, there are 211s across the nation. 94% of the nation actually is covered by 211s. But San Diego 211 is probably one of the better well-known ones, one of the largest ones, as you'll see in a minute. So what is 211? I said, easy to remember number, just dial 211, three-digit dialing code. We offer service 24/7. We know people are busy with work and life, so maybe you come home after a day of work and you're tired and you're hungry for dinner. That's okay. You can call us later in the evening, or you can call us during the weekend if you've been meaning to call us and get some information. The other cool thing about 211 is that we can, we're 24/7, that's 365 days a year, every year. And the other cool thing is that we offer up to 200 languages that we can serve people in. Now, that doesn't mean we have people, 200 different languages in the building, that people who speak 200 languages or 200 people who speak a separate language. But we have a lot of languages that are covered here in San Diego, like Spanish, Tagalog, Mandarin. But we also have a service where we can bring in a translator or interpreter to do the other languages. It's confidential. When you call us, we're dealing with you. We're helping you. We're not providing the information to the public. It's free. That's the big thing. When you dial 211, it's free. And we are certified by a group called the Alliance of Information and Referral Systems, which basically means that we are certified to provide information and we have a duty to help individuals. And when people call us, they are opening up a world of access. They have access to over 6,000 community health and social service programs that we can refer people to. In providing all that, what we're trying to do is help individuals overcome barriers to accessing services. And so when we say we strive to create equitable access to care, We do that right now for our callers who call us right now, but also through the future through different systems. The other thing is what we do is we have a history of being able to rise to the challenge during an emergency, like the wildfires that have hit San Diego, but also we've seen in the past year, like the pandemic. Wildfire eventually burn out. This pandemic has been going for a year, and we continue to serve San Diego. Now, some of these numbers I gave you already, but let me go over some of them. We average about 400,000 connections a year. But in the past year, because of the pandemic, we handled more than 1 million calls from people looking for help. We connect to over 1,200 service providers. That could be a food bank, that could be a health clinic, many services. It could be SDG&E too. We have 200 languages that offer translation. And, we do pretty well with customer satisfaction and accuracy. And we've grown. When 211 first started, we were in a small office in the strip mall, and we've now grown to over 300, close to 400 people. And a lot of those people have come on during the past year because of the pandemic. The things we focused on, as I mentioned, are health and social service program, so-called safety net program. We provide health navigation, which means we help navigate people who have complex health situations, including chronic conditions. We can enroll them in Medi-Cal and Covered California, and we can educate them on how to use their insurance while also building long-term care plans for the future. The safety net program, a lot of those, as I just mentioned, Medi-Cal and the CalFresh and EITC and CalWorks, a lot of these programs are offered through the county or the state, and we partner with them. And we have expanded those services and programs over the years, but we work very closely with the County of San Diego because they do a lot of the health and social service programs in the region. And we have a call agent who help with the access line that the county has, and an enrollment center for public benefits for CalFresh and Medi-Cal. Housing is a big issue in San Diego. And the 211 navigation program serves as a single access point for client for care coordination for San Diegans who need help with housing. Now, let me say that our ability to connect clients to services is limited by what services are available. Sometimes, and sometimes in many cases, there are no immediate resources if someone calls looking for emergency shelter or housing. Our staff will always try to provide referrals and will try to help someone solve their problem. This may include creating a safety plan if their only choice is to remain unsheltered. So we'll do our best to help people, but we can't always meet everyone's needs. Someone may call us asking for a 2-bedroom place because they have kids or they have older adults with them. We can't always guarantee that we can get them a 2-bedroom place. Again, it depends on the availability of that certain day and that certain week. But again, our navigators will prevent housing options if any are available. A big part of what we do is also military and veteran services. And we have a partnership with the county and with a group called Mental Health System and with Veterans Village of San Diego on a program called Courage to Call. Courage to Call is basically a 24/7 peer advocacy program. What that means is if you're a veteran and you call and ask for Courage to Call, you're going to be connected to another veteran. We know the military has its own lingo, has its own protocols and specific way of doing things. By connecting you with another veteran, they'll understand better your problem and they'll try to help you. And they can help assist you with connect you to the VA program for benefits and claims. They can help you connect to rental assistance and supportive housing. We can also refer veterans to landlord-tenant dispute program, education and employment, mental health services, and caregiver support. As is said in the military, we don't want to leave anyone behind, so we work to do that. I mentioned briefly about emergencies and how 211 is very active at doing emergencies. We act as a 24-hour non-emergency information line. What that means is if there's a fire or if there's a shooting incident, obviously people should call 911 first if they're in the middle of that emergency. But if there's a fire and you're wondering if they're evacuating your neighborhood, and if so, where do you go for to shelter? That's where 211 steps in. So we take a huge load off the 911 system, and we provide real-time information that we get from our public safety partners like County Office of Emergency Services, CAL FIRE, FEMA. We've worked on everything from landslide to winter storm. We responded during the fires in 2007, 2014, there was some other fires. And we have a lot of partnership, and that really helped. Let me give you a perfect example. You may recall last year that there was a fire on the Navy ship in San Diego Naval Base, the Bonhomme Richard. And so when that fire broke out, one of the problems was that a lot of the smoke was a pollutant, was toxic, and a lot of people living in Barrio Logan, National City, close to the ship, were having breathing problems. So we worked with the mayor of National City, Naval Base San Diego, the port, the city of San Diego, and the Environmental Health Coalition to have a program where residents can call 211 and we would set them up with hotel vouchers so they could leave the neighborhood for a couple of days and not be exposed to that smoke. About 400 families participated in that program during the fire. And that's a perfect example of how 211 can be very nimble when something happens and can use technology and people to quickly support the community during an emergency. Client experience is very important to us. Excuse me. As I said, we realize, and so we really strive to make sure that when someone calls us, when a client calls us, that they have a good experience. So we have coaches who work with our call agent to make sure they properly answer the phone and properly find the information. We try different products, services. We can collect and analyze data. And as I said before, we know that San Diego is a very diverse region. So we do offer multiple languages. Our call center is staffed 24/7 with people who speak both English and Spanish. And when we know there's going to be a surge in call, or when we suspect there'll be a surge in call, especially Spanish call, we make it a priority to leave the Spanish speaker and set them aside to handle those influx of Spanish call. Or rather than if you speak Spanish talking to somebody who speaks English, try to make sure that agent speaks to somebody who speaks Spanish only. Our website is also friendly when it comes to different languages. You can go to the top right-hand corner of our website. There'll be a drop-down menu, and you can translate the site, the information on the site, into several languages, including Spanish, Tagalog. And then, we tell people if one of the languages you speak isn't there, then go ahead and call us. And we have that translation services for over 200 languages. As I said, this year has been very difficult, even though we're used to dealing with emergency. This year, past year, we've dealt with COVID, and it's been an ongoing thing. So we've been working very closely with the County of San Diego to support their effort, everything from COVID testing sites and appointment sites to vaccination, letting people know about eligibility phases, And when the county activated us to respond to COVID over a year ago, we knew there were a lot of unknown. At first, people were calling about COVID, how it spread, symptoms, and then people started calling about the public health order. What does the health order mean? What can I do? What can't I do? And, people call 211 for a lot thing. And we started seeing people call with basic need like food and housing and rental support. At first, we saw people being left out of the food delivery program, how we work with partners to fill those gaps. And then came testing, and we worked to make sure that people knew where the walk-in sites were, where they get results. And our technology was a big barrier. A lot of people didn't have the internet to be able to schedule a test. So we started working with the vulnerable population, folks 65 and older who needed to get vaccinated. And we worked with them. We would actually make the appointments for them if they called us. If they didn't have internet access or a grandchild to help them, we worked with them on that. So we found a lot of communities in need. We saw neighborhoods with higher rates of spread. And we worked with the county to address those needs. It was a delicate balance of providing appropriate services while also trying to illuminate the needs. But these barriers to access were there already, and we were trying to, they were exacerbated during COVID. So we were trying to help them out. And there were other things too, like some people were trying to get to the Petco vaccination site. They couldn't drive that far, or they couldn't leave their house. We helped arrange transportation for people who couldn't get there. We also started taking the list of names of people who are older and couldn't leave their house. And that list we provided to the county for a homebound seniors list. And the county set up teams to go visit them and respond to them and give them vaccination. This is the most recent data. I'm not going to go through everything, but as you see, in April alone, we've had over 28,000, probably 30,000 calls by now. A lot of those seeking information on the vaccine. And then you'll see cumulative 122 is when we actually started helping people with vaccination appointment. And you're seeing over 347,000 calls. Even though we get a lot of these calls, you'll see that a lot of the calls we were able to answer within seconds, maybe a minute or so. So we're very proud of that. And I mentioned the homebound seniors you see at the bottom, over 1,700 homebound seniors who were added to that wait list. One of the things that 211 does is also unique, and we sort of modeled a pattern in the country, a program called the Community Information Exchange. And what it simply is if you call us and you agree, we will put you in this program. And what this program is over 100 partners who work in it and who agree to share information. So that if you call, for example, and you're having a problem with food, but you're also having a problem with mental health, we can put your information in this program, in this database, and the different partners can see the different needs that you have and work to help you out with those needs. It idea to help people across various sectors and improve health and wellness for individuals and the population, and it worked really well. We created this program because we knew that people's health is affected by various factors, socioeconomic factors like job status, income, the physical environment where they live, where they work, the health behaviors. So CIE is an effort to address that, and it's a person-centered model. Individuals benefit from CIE because it provides like a universal life record of event and system interaction for that person. And it allows us to be more responsive to people's needs. We're getting close to the end. I know we only got a few minutes too, so I'll be wrapping up soon here. CIE core components include network partners, um, a closed loop for referral, and we can refer people within that loop, technology, a lot of community care planning. So the data that we collect for that is can be used for local planning and to advocate for policy change. And again, I want to emphasize CIE is voluntary. We don't sign you up when you call. We only sign you up if we explain the program to you and you agree to do it. And as I said, we have 102 partners. These are just some of the partners. Again, everything from health clinic to organization, the Salvation Army, San Diego Workforce Partnership, Father Joe's Village. You see them all. 211, again, you can call 211 real easy, but if you're the kind of person who likes to search on their own, one of the things you can do is go on our website, and it's very easy to use, and look up what you need. So for example, in this screenshot, this is what our website looks like when you look for it. So if you look, there'll be a search button, and if you type in the words like food bank, because you need food, and you type in your zip code, you'll get a listing of the food banks of change programs in your area. It'll provide you the phone numbers and the information, the address, and a map of where to go. You can do food bank. One of the things we've seen, I know this came up before, is rental and housing assistance. So if you go in there and put in rental assistance or utility assistance, it will show you the different programs that we have available. The good news is right now, there are 3 different programs for rental and utility assistance. There's the City of San Diego one, there's a City of Chula Vista one, and for everyone else, there's a County of San Diego program. And our agent have that information. So call us, check our website. You can look for all that, and it's very helpful. And I'm going to close here by, again, emphasizing that we're easy to reach. Just dial 211. I forgot to mention earlier, you get a live person. In the beginning, you get like a prompt as to try to direct you to the right person. But after that, you get a live person. We're available 24/7. All the calls are free. If you'd rather use the website, you can go to the website, 211sandiego.org. You can also follow us on Facebook, Instagram, Twitter, LinkedIn. The benefit of following us is that when we have new information about rental and utility assistance or vaccinations, whatever, we'll put that up there and you'll see that. So with that, I want to say thank you. That's my presentation, but I'm happy to take any questions.